19,500 Albertans have now recovered from COVID-19. That is almost 850 recoveries added since I last spoke on Friday. Currently, 116 people are in hospital. Last week I mentioned the trend in higher hospitalization numbers is something that we are watching closely. We are currently at a compounded daily COVID hospitalization rise of 3.1% across the province in the past 2 weeks, which is getting closer to the 5% trigger threshold. I am concerned by the rise, which appears to be driven by a number of factors, mainly the increase in community case counts and several hospital outbreaks. There are currently 16 cases admitted into ICU, which means that 23% of the 70 ICU beds allocated for COVID-19 patients are currently being used. We completed more than 13,000 tests in the last 24 hours and identified 323 new cases of COVID-19. Our provincial positivity rate yesterday was about 2.5%. Sadly, I must report one additional death from COVID-19. While I share these numbers for transparency and as a reminder of what we are all collectively working to prevent, it is important to remember that we have lost many Albertans to many different causes since this pandemic began. Every one of these was a person, not a number. Every one left behind loved ones who were having to cope with grief. All of us know someone who is grieving a loss, and we can reach out to offer support. It is one of the many ways that each one of us can make a difference. Turning to schools, there are active alerts or outbreaks in about 8% of all schools, with a total of 512 cases. There are 96 schools on outbreak, including 26 that are on the watch list, with 5 or more cases. Health and school officials are acting swiftly every time an outbreak is declared or an infectious case is identified. That is a key reason why, to date, we have seen in-school transmission in only 69 schools, including 44 of those that had only one new case as a result. I continue to be concerned about the situation in the Edmonton zone, which currently has about 50% of the active cases in the province. It has now been almost 2 weeks since we put additional voluntary measures in place for the Edmonton zone. There is some good news in Edmonton. The rate of growth has started to slow somewhat, and our R value in Edmonton has come down from 1.35 to 1.17. This is a good start, but the bad news is that any time the R value remains above 1, the number of cases is still growing. We need to bring this value below 1 to reduce the burden on our health system. Please continue your efforts to bring the numbers down. In the past few weeks across the province, we have seen several examples of how COVID-19 can spread from one person to many very quickly. This happens even when people are doing their best to try to follow public health guidance. We have seen a wedding celebration where 43 of 63 people in attendance ended up with COVID-19. We have seen a social party where we know of 8 cases out of 24 who attended, and follow-up is ongoing to determine if there are more. And finally, we have seen a workplace gathering where people who worked together attended a common social event. Of the 29 who attended, we currently know of 9 who are positive and 38 people who are excluded from that workplace as a result of subsequent exposure incidents. I want to first thank all of the participants of these events for working closely with contact tracers to protect their loved ones and their community. They did not set out to make this happen. At these events, COVID-19 has spread quickly and dramatically among well-meaning people. I want to remind anyone planning any kind of social gathering that it is critical to keep your gatherings small, to ensure that anyone with symptoms does not attend, to make sure that all those attending are keeping distance from each other, and ideally, as a precaution, wearing masks, as in social gatherings it is very difficult to keep distanced at all times. It's also important to make sure everyone is regularly washing or sanitizing their hands. COVID-19 really does love parties, and we need to keep this in mind when planning or attending social events. Finally, today I am announcing a significant change in Alberta's testing approach that I believe is a critical step to improving COVID control in the province. You may remember that in mid-September, I announced that our health system is facing a significant challenge over the fall months. The cold and flu season means that in addition to potentially contracting COVID-19, Albertans will have a greater chance of catching a cold or the flu, which often have similar symptoms. On September 17th, I announced that Alberta was shifting to offering asymptomatic testing for priority groups only. This was a strategic move to help us prioritize our testing and focus where it has the greatest clinical value. Even with this shift, since that time, our labs have been processing more tests than ever before. Wait times for results have not decreased as much as they need to in order to use lab test information to prevent spread in an optimal way. This is largely due to the increase in Albertans with cold and flu symptoms. With both COVID cases and the number of symptomatic tests rising, we must take further action. That is why, effective immediately, we will be pressing pause on all asymptomatic testing in those who have no known exposure. This is an important and necessary step that will help us reduce testing wait times, get results to Albertans, and limit the spread. To be clear, we will continue testing any Albertan with symptoms and anyone who has no symptoms but is a close contact of a COVID case or is linked to an outbreak. These are our top priorities and the people most likely to have COVID-19. However, AHS and community pharmacies will no longer be booking new testing appointments for any asymptomatic Albertans who have no known exposure. Appointments that have already been booked will be kept up to November 4th. I know that asymptomatic testing can provide some comfort to people, but the evidence is clear. Asymptomatic individuals without known exposures are not significantly driving the spread in Alberta, and this testing is not an effective way to identify cases of COVID-19. We have now completed more than 659,000 tests on asymptomatic Albertans with no known exposure. Of these, only 0.11% have come back positive. This has increased slightly from the previous statistic I shared of 7 cases in 10,000, but this is still very low. Only about 1 in 1,000 people with no symptoms and no exposure has tested positive on average over the past 7 months. This means it is very rare to find cases in those without symptoms and without known exposure. We need to focus our testing where it counts, so that anyone with symptoms, including children held home from school, and anyone who is a close contact or part of an outbreak, gets results as quickly as possible.